I guess in approaching the talk today, I kind of thought, what would be the most useful thing for you to know about what's happening in Australia? And the panel last night actually was very, very helpful in terms of what themes started to emerge and that have come up again in the conversations this morning. So the things that I've been hearing predominantly from people is that we know there's a really significant need in terms of mental health, and particularly around unmet need for help and support. I'm hearing a lot about that we think that there's amazing potential in technology. We know that technology has something there for us that can help us address this unmet need. And we're starting to get an idea that there's lots of good things happening around the place, but we don't all know what they are, and we're kind of being surprised by what's going on and wishing we knew about things, and all of that's coming together so that we're going, how do we find those things, join them up, turn them, use the best of service innovation, the best of technology to build a system that actually gets help to people who need it. My presentation is not going to answer that bottom question because that's not something I can do by myself and do in one presentation. But what I hope I can do today is talk you through some of what's happening in Australia, where I come from. I'm not going to talk about koalas and kangaroos and things, but tell you a little bit about what has been happening in Australia at a high level, not in any, I can't possibly take you through the exhaustive list of things that are happening because there is a lot, but hopefully give you a bit of a sense of some of the things that are going on so that you can either find where there are things that we're doing that are similar to what you're doing and where maybe we should be talking to each other and seeing what we can learn from each other, seeing maybe there's things you can pilfer straight from us, really looking for where there's opportunities that you can learn from what we've done, teach us something, and where we can actually start bringing all the bits and pieces together so that we can really effectively do something with technology to address mental health need. So as has been said, this starts, actually no, before I start, I'll give you a little bit of context about Australia. So many of you might have a good sense about what's happening in mental health in Australia, some folks not so much. So we're not so different to a lot of Western societies where mental health is a significant issue for us. Suicide in particular is of great concern. It's the leading cause of death for young people under the age of 24. And again, like many other Western countries, young men in particular are at high risk. They're 4 times approximately more likely to kill themselves than young women. And young people living in regional and rural areas of Australia, which is a lot of Australia, are also at particular risk. The good thing about the situation in Australia is that young people are online a lot. And in fact, recent research that was conducted by the Young and Well Cooperative Research Centre found that 99% of young people are online daily. So there's some incredible kind of strengths and opportunities that we can use in the way young people are using technology to try and address some of the issues we have around their mental health. And Australians, in fact, are well known for loving social media. We're one of the highest social media using nations in the world. I don't know what that's about, but we are. And so there's a whole lot of stuff happening in technology in Australia that means that we're kind of the perfect place to go, what can you do around technology to address mental health? So, 15 years ago, which is a relatively long time ago, and Australia could practically be a galaxy. It's a pretty long way away. You've heard a little bit about the story that Elaine told already in terms of where reachout.com came from. And I think it's worth really reflecting the fact that 15 years ago, Facebook didn't exist and Google was kind of only just being launched. And certainly in Australia, internet penetration was incredibly low. Not that many people actually were online. And the people who were going online were doing it via the old dial-up modems. You can probably remember that little dial-up noise that it used to make while you waited to see if it would connect. So it was not a particularly technically savvy time. But the other thing that was happening is that those statistics around what was happening for suicide for young people in Australia were much worse. And in fact, suicide rates for young people were dramatically increasing. So the experience that Jack had personally was being repeated all over the country, and there was this real issue around what do we do? We've got a real concern about suicide amongst young people. So Jack, in launching reachout.com, was doing something. You could say it was a bit crazy, maybe it was visionary. It was certainly a big leap to take, to go, maybe we can take this new technology that's just starting to emerge and use it to address this really significant problem. And I think there's an initial learning there, which is that we should never be afraid to be really bold. and to try and work out what's happening with technology and not wait for something to become incredibly well embedded and well used, but be really proactive about trying to work out where technology might be going, how people might be using it, and go, what can we do using those things to start addressing some of the challenges that we have. And it turned out that Jack was right. Using technology to address mental health was a good idea. ReachOut.com was launched in 1997, and by today's standards, it was not a particularly sophisticated service. It was effectively a static website with some kind of information on it. But what was radical about it was it meant that you could, if you had one of those internet connections, you could access it, and you could access it anonymously. And so as a young person, for the first time, you could start getting some information about what might be happening for you without having to turn up at a service or necessarily tell your parents or identify yourself. Since then, the service has really grown. We now are accessed by 1.4 million people a year, so it makes us the most accessed mental health service in the country, in Australia. We've certainly grown in terms of the sophistication of the offerings. So one of the early new developments we did was to establish forums, which enabled young people to talk to each other and share their experiences and share help in a safe and a moderated space. Increasingly, we are looking at how we can build self-help tools and things that so young people aren't just receiving information, but they're able to pick up things and do things to help themselves. And so over the 15 years, it's clear that as a model has really worked. But I think what's almost more exciting, actually it is more exciting over the 15 years, is that in addition to Reach Out really growing as a service, so many other services and tools and things have moved into this space and have joined us. That's a very interesting looking slide. I might move past that. I have no idea what happened there. That's interesting. Broadly, you can kind of group the online services and tools that are available into three categories, which is what that terrible slide was going to depict. I guess in the realm of where you can have the greatest scale is around services that enable self-help and enable peer-based support. So they don't need a clinician right in the middle of it, kind of involved in every interaction. They are very much, I think John Murphy last night talked about using the size of the problem to help with the size of the problem. So they're very much really drawing on the community to help the community. And there's a range of services that sit in that self-help and that peer support space. The next level up then brings in a little more clinician involvement, and you kind of call them clinician-directed or assisted type services. And then at the next level up, you've got services that in some ways kind of replicate traditional kind of face-to-face type services around counselling and things, but do them online. So I'm just going to take you through, again, like I said, this is not an exhaustive list because I could probably do this presentation all day in between coughing, but rather just to highlight some of the things that are good examples of the types of services that I'm talking about. So Mood Gym has been mentioned a few times, and that was a cognitive behaviourally based program that was established quite a long time ago out of the Australian National University. It has been rigorously evaluated. There's been a number of RCTs done which has found that provided people don't drop out, which is the challenge, they absolutely experience some considerable benefit from going through that program. Both in terms of reducing symptoms for people at the time, but also about those benefits having benefit kind of 12 months and beyond past completion of the program. A more recent entry into this space is something called My Compass, which is a program which is run out of an organisation called the Black Dog Institute in Australia. It's predominantly aimed at people 16 years and over who have mild to moderate stress, anxiety or depression. It's quite complicated, enables quite a lot of self-monitoring of various kind of moods and behaviours and medications and things like that, and then has wrapped into that a range of self-help modules that will help, designed to help teach people to self-manage depending on what's going on. Again, Black Dog Institute have a great research program, so they're constantly evaluating the effectiveness of this. It's on the beauty of online services, of course, is they are online. So I'd encourage you, if this is something that you're interested in, go on, log on, kind of try it out and see what it's about. My Compass can be accessed both through a mobile phone and online, and enables that really comprehensive tracking of things. The other thing that's happening in the self-help space more recently is a lot of development of mobile phone apps. The other thing that's happening in Australia, and I believe is a trend all over the world, but it's accelerated in Australia, is about people less and less using desktop PCs to go online and more often using smartphones and tablets to access online material. And so again, we're trying to respond to that and react appropriately and make sure that there are things online. The beauty of phones is they have some pretty amazing functions and they're with you everywhere you go, and so you start to really free up some of the things that you can do. And so there's some really interesting stuff being done in the mobile phone kind of space. This picture comes from a mobile phone app which is in development, and it's specifically focused at Indigenous Australians, Aboriginal Australians. Aboriginal Australians also have higher than normal levels of suicide and of mental health difficulties, and are often not very well served by a lot of the mainstream services that are around. So this app takes a really different approach. It's very text light, and they're trying to avoid too many words and too much text. They're trying to draw as much as possible on the kinds of stories and imagery and language that have traditionally been used in a lot of Aboriginal cultures. Uses a lot of audio, so you can listen to things and record things, and lots of imagery. So if you reflect on the My Compass slide, one back, which has got graphs and words, and that's how you track your progress. This application, this is how you track your progress, with those circles and stars representing different things as you go through the program. And so it's a far more kind of visual representation of what's happening. And I think this kind of stuff is really exciting because it's a very different approach to try to engage people, keep them engaged, and give them the kinds of support they need. There's another app called Smiling Mind, which has been incredibly successful, and it's described as a modern meditation app for young people. Not just for young people though, I think lots of not so young people really enjoy it. Again, in your pocket, or you can access it online, and it's all focused on meditation and on mindfulness in a way that's really accessible, really easy to use, and that people enjoy using. I think this is then probably where there's another useful learning for folks. That one reason why these two things are probably so successful is because they're designed very much with the people who are going to be using those apps. So Smiling Mind was designed with young people. So how do we make meditation good and exciting and engaging for young people? Well, let's work with young people to design that app. And similarly, how do we design a mental health intervention that's going to work for Aboriginal Australians? Well, we talk to Aboriginal Australians about what's going to work for them. I think that's an incredibly important thing to do. In technology space, they do this all the time. They have user experience and participatory design, and they don't build anything without sitting down with the person who's going to use it and work through it with them. I think in mental health spaces, we tend to be a little bit more used to the expert, the clinician who designs things and then gives them to other people. And so there's something we can really learn there from technology and go, how can we design our programs with the people who are going to use them so that they're most successful. We think about the next layer up of intervention, which is the kind of clinician assisted. There are again a number of services which kind of bridge that hybrid a little bit between some elements of self-help and some elements of engaging with a clinician. One of them that's been around for quite a long time is called This Way Up, which is run out of St Vincent's Hospital, which is associated with the University of New South Wales. This service actually requires a referral from a GP and has a small fee associated with it, and is, as I said, that hybrid of a clinician actually working to guide a person through a series of programs. Again, very much with a focus on anxiety and depression. Again, it's been quite extensively evaluated, including through some RCTs, and has been found to be really effective. Part of, I think, the argument around the clinician assisted is to get past some of that stuff of people disengaging. So by helping to make sure that there is a clinician, there is some human support to help people stay engaged with the program and therefore get the benefit they want. A more recent entry into this type of service is one that actually was built and funded by the federal government itself, called MindSpot. It is all ages, but I think it would be fair to say skewed to an older audience. I'm saying that based on the kind of photos that they use, which tend to be of older folks largely. Also, again, has a depression and anxiety focus. Very much just set up that you do some initial screening and assessment. You're recommended some modules to work through, and then you can check back in with your clinician to see how you're going, and they will look to refer people on to to face-to-face services if required. The last area, which of course requires a lot more intensive human resource behind it, is in clinical services that are delivered in an online space. And again, there's a whole variety of these that exist in Australia. One of them that is quite well known is eHeadspace. So I think Headspace and Headstrong are kind of, again, sister organisations between Ireland and Australia. So eHeadspace takes the traditional Headspace kind of face-to-face model and is doing it largely online, focusing on the counselling and the support that happens there. So they have trained clinicians who will both respond to email responses that may come through and who also provide counselling and support via chat or via phone. Certainly not the only service who do that. Kids Helpline, they're targeted at young people under the age of 18. They also do online counselling. And Lifeline do crisis kind of response online as well. Some really interesting reflections from Lifeline when they moved into doing online crisis for them was that they got a younger audience. They increasingly got folks from outside of cities, and that people disclosed much more quickly, much more serious issues. So on the phone, it took a lot longer for people to work up to actually saying, I am feeling suicidal, or talking about quite serious issues. Whereas online, people tended to move really quickly to disclosing quite serious issues, and that the proportion of interactions that featured people in very high distress was much, much higher than what they experienced on the phone. So I think there's also, again, probably some interesting things to explore there around what is it about technology that enables people to disclose much more quickly and to feel comfortable talking about much more serious issues than they might in other methods of support. I'd also like to give special mention to the work that's been done by an organisation called HitNet. Now, HitNet's not specifically a mental health organisation, and the interesting thing about their work is not so much in the services they deliver, but in the work they're doing to make sure that people can access services. So Australia, as you all know, is an incredibly large country. And particularly for many Aboriginal people, they can live in incredibly remote places where it is a bit like going to another country. There sometimes isn't electricity and water, and they are incredibly remote places to get to. And so HitNet have grappled with well, we've got amazing services, but how do we get them to people who are not in metropolitan areas, who don't have amazing Wi-Fi, may not even have a computer? And so they've come up with these community hubs, these literally kind of little stations that they've put in there. I think they're in about 70 or 80 remote communities now around Australia, where they load up these stations with all of the kinds of services and information that everybody else can just access through their phone. And they do great community building work with the people in those communities so that people then have this community resource that they're able to come to and access. And I think that's then the other important thing to think about, and something we've thought about and done some work on in Australia over time, is it's all very well and good for us to develop great services online, and the majority of people who are easily able to get online can benefit from them, but it's often the most vulnerable people and the people who most need those services who may have real access issues around getting online and using those services. So what do we do about that? Inspire, in our early days, we did a program with youth services, which was literally about putting computers into youth centres and training people up how to use them. That's a bit redundant now. A youth centre without a computer would be a very strange thing indeed. But certainly when we're thinking about perhaps people who are homeless, people living in remote locations, thinking about some of these hardware and access issues are really important. The same for accessibility issues. It's one that we continue to find challenging. It's things around people who may have very low literacy, or people who have visual impairment or hearing impairment, or various things. How can we make sure that these services also work for folks from a variety of backgrounds? Thinking forward, there's been a fair bit of mention made of the Young and Well Cooperative Research Centre, and I think it really does deserve a very special mention because it's pretty unique. So the CRC brings together 70 partners from not just mental health services and not just research institutions, but it also includes a bunch of amazing corporate organisations. So we've got organisations like Google and like Yahoo in there. And those 70 organisations are all working on the thing we're talking about today, which is how can you both mitigate against some of the risks of technology, but more importantly, use the potential of technology to do amazing things for young, specifically in this case, young people's wellbeing. The centre is worth around $100 million and is going to run over 5 years. Around $30 million of that comes from generous support from the federal government. And why I think the CRC in particular is so important and interesting is that technology moves so quickly and there is so much happening that it is not possible for us just within the mental health sector to come up with all of the answers and do all of the really interesting things. Collaboration is absolutely essential. And that is what the CRC is there for. It's to facilitate that collaboration and make sure that you're bringing together the people who are doing really interesting work in terms of mental health research and service delivery with the people who are staying on top of what's happening in technology and going, how through our kind of powers combined can we do really good things. The other thing, to touch on what I was saying around there's the services for Indigenous people and young people, the other core feature of the CRC is very much, again, that it is driven by working with young people to deliver all of the services. So it's going, let's bring the best of technology, the best of mental health, and young people together to go, where are the solutions at the nexus of all of those things. I'll talk you through this one as well. So the CRC has 3 broad program areas. So the first one is safe and supportive, which is really looking at the broad population, looking at all young people and going, what can we do to support young people's mental health and wellbeing, regardless of where they're at in their life. It looks at things like cyber safety, looks at things like promoting resilience. If you jump online to youngandwellcrc.org, you can get this in a not messed up version and be able to see kind of the individual projects that sit underneath that. To give you one example of that, one that Inspire Australia is currently leading, is we're working on a thing called the Online Wellbeing Centre, which is about looking at the fact that there's a heap of health and wellbeing apps out there, heaps and heaps of them. And if you're the average person jumping on iTunes and typing in wellbeing app, you'll immediately be overwhelmed, and it's really hard to find what is a good app that I know has some evidence base behind it, is going to work, isn't going to crash. It's quite overwhelming. So the Online Wellbeing Centre is designed to provide some screening of young people to help direct them to useful apps, and importantly, to actually try and work through the hundreds of thousands of apps that are out there and identify the ones that do have good evidence base, that are engaging, that aren't going to crash the minute you open them, and present them in a way that's therefore personalised and tailored to the young person who's coming through. So that's both a technological challenge in terms of how do we find those apps, curate them, present them to a young person, and direct a young person in a personalised way to the thing that will suit them, as well as obviously working through how do you rate a good mobile phone app from a health and wellbeing perspective. There's heaps of stuff around engagement from a tech perspective, not so much work that's been done around what makes a good health app. This will be messy too, I'm going to guess. Yes. The second area of the CRC is a section called Connected and Creative, and that very much speaks to the more young people who are more vulnerable. So there is a lot of work happening in there, for example, focused on GLBTI young people who the statistics for mental health and suicide, particularly in Australia, are pretty bad, very bad. The rate of suicide and risk amongst that cohort is extreme. And so this project has things like some digital storytelling projects with those young people. There's some really interesting gaming projects of young people working with very marginalised, vulnerable young people working with gaming developers to see what they can do to help kind of give them ways to tell their stories, be connected, and support otherwise very, very vulnerable young people. Again, encourage you to go online. You'll be able to get a better picture, literally, than that. And for the third messy slide, yes. The third area of the CRC is called User-Driven and Empowered, and it is specifically focused on young people who are experiencing some mental health difficulties. So there's some projects in there which are at the more clinical ends of things, looking at things like virtual clinics and clinics that bring professionals and young people together. And also in there's a lot of development and focus on things that are self-help tools and apps in there. So one project that is an Australian-Irish collaboration that sits in there is a project to see if we can build a mobile phone app which will help with the moderation of sleep-wake cycles. There's some really good research that says that if your sleep-wake cycle is out of whack, the impact on your mood and potentially on depression and anxiety is quite significant. So can we build a phone app that will help young people moderate their own sleep-wake cycle? And anyone who's had anything to do with teenagers will know it's going to be a challenge. But can we build an app that will help young people do that, so that by sorting that out, then their mood and things are better? So again, like I said, really encourage you to jump online and have a look at that. The final thing that I would like to talk to you briefly about is around the policy context more broadly in Australia. So Reach Out launched in 1997, and in 2006, nearly 10 years later, the federal government decided that delivering funding to services that delivered their service online or via telephone was maybe a good idea. And so 2006 was the first time that services like Reach Out, not just Reach Out, received funding from the federal government to do their work. In 2011-12, there was a next tentative but welcome step forward from the government, which was the release of something called the E-Mental Health Strategy for Australia, which was, as titled, an E-Mental Health Strategy for Australia. A slightly unkind reading of it would say that it was less a strategy and more a collection of initiatives, but they were good initiatives, and as a first kind of foray into this, it was very, very welcome. The three initiatives, the first one was a portal. So the government was really concerned that there is increasing numbers of services, and how would people find the services that were good was what the government was concerned about, and how can we kind of aggregate and curate and make it easy for people to find those services. So again, if you jump online, you can have a look at the government's portal. It's called Mind Health Connect, and it does some basic screening and then recommends people services that exist. It's a pretty expensive initiative. I think it's worth around about the $14 million mark. And we've just had a new government come in at the federal level, so I think they'll probably, whether Mind Health Connect continues, whether it evolves, will be interesting to see. But it was very much, I think, the government's attempt to try and see what they could do to help coordinate and integrate services. MindSpot, which I've already spoken about, was the second kind of initiative listed in the strategy. And the third one, which I think actually is genuinely exciting and has the most promise, was broadly called the E-Mental Health Support Service. And the focus of that was to look at a few things. One was about training up primary healthcare providers and other face-to-face services to increase their comfort with online service delivery and knowing what was out there. So really recognising that you can have all these great online services happening, but actually if the people who were sometimes having first contact with folks in distress didn't know about them or didn't have confidence in them, then you weren't going to get that referral happening. So an initial training piece, and then a second piece to really look at, well, can we better integrate your traditional offline face-to-face services with online services? And I think that's critically important in terms of mental health policy and service system design anywhere in the world where we're talking about it, is how do we make sure we don't have these two systems kind of running in parallel, but actually have them working together in a way that really augments both sides of that. So that's still quite a new initiative. It's kind of in the setup stage at the moment, but I think once that's rolling out, it'll be incredibly important. As I said, we've just had a new federal government roll in. That was in around about three weeks ago. And their mental health policy was called the Coalition's Policy for Efficient Mental Health Research and Services. I like that it's the efficient mental health research. I'm interested in what efficient mental health research might look like. I suspect they're largely focused on efficient mental health services. One of the exciting things in there certainly was a commitment to provide an additional $5 million to the Young and Well CRC for something that's been called One Platform. And that is to do what I think Mind Health Connect didn't do, which is really look at how you can integrate the existing online services and to capture information, to capture data about people in a common way that services can access, so that process of moving between services online is better and easier for people. So that we can kind of get some efficiencies and avoid some duplication in that space. And they also really talked a lot, as per the title of the policy, about more efficient mental health research and services. They're going to do a large review through our National Mental Health Commission around what mental health services we're delivering. And I think that there's probably some real opportunity in there if we advocate strongly to talk about the benefit that online services have at being exactly that, at being both efficient and effective as a way of delivering service. So to finish, if I think about where we've come over 15 years, what the kind of current context is, certainly the review of services I think presents a really interesting both challenge and opportunity for online service delivery in Australia. There is still some work to do to convince people that online services are as effective as offline services. And so there's a risk, I think, in terms of if review decides that maybe they're not. But that's up to those of us who work in the area to convince them that they really are. The e-mental health strategy is due for a new iteration, and I know that speaking to the bureaucrats in the department, they're very conscious of wanting to develop a proper strategy that really is very future focused and looks at where we're going and looks at how we're going to measure our progress. There's a lot of work being done in Australia at the moment around social media, specifically in relation to suicide, and some great work that's been driven by the Hunter Institute of Mental Health in that area. As I said, a lot of focus on service integration. Now we've got so many services and products, we're really interested in how we make it easy for consumers to move between them and don't duplicate things. And continuing, the challenge for us obviously is to continue to stay abreast of technology as it changes. So as people are wearing Fitbits and various kind of biofeedback devices, what are we doing to use them? What are we doing in a gaming space? What are we doing as social media morphs? How do we stay on top of those technological innovations and use them in a really useful way? A lot of those challenges are things that we kind of need to largely deal with in an Australian context, but a lot of those challenges are things that actually will be benefit from international collaboration, from bringing together things that are happening across the world. And so I think that's where I'd kind of like to finish with, is that I think this conference is great for starting that conversation, starting to get us thinking about what is going on, where we can learn from each other, but it needs to just be the beginning of the conversation and we need to keep it going. So you can find me there on those places, on Twitter and on email. I'd be very happy to direct you to any of the services that I've spoken about if you want to contact with them. And I think it's by having those conversations, using technology to facilitate them, given we're quite a long way away, that we'll be able to really help drive some of these things in the future. Thank you.